There's a quote that we use a lot, especially when we're talking to judges and prosecutors and all of that. That's like, when a flower doesn't bloom, do you blame the flower, or do you look at its environment? Like, what's making it not bloom? The soil, the sun, the heat, whatever it might be. And that's kind of what the approach that we take, and we're not coming in and being like, you're not doing anything right. You have to fix all of this. We're coming in with very basic skills and strategies to make little adjustments to make it be successful in whatever environment they may be in. A judge once told us, we're not born in a vacuum. Like, we are not born with the ability to know what to do for kids with high needs. You have to learn that. And we've also realized throughout this process, there's been a lot of, gaps in certain services and for these families and for these kids. And so we're trying to bridge that gap and just provide them with the most support that we can with the science that we use.
I'm Rachel.
And I'm Jessica, and this is All Things Sensory by Harkla.
We are both certified occupational therapy assistants, and together with Harkla, we are on a mission to empower parents, therapists, and educators to help raise confident and strong children of all abilities.
On this podcast, we chat about all things sensory, diving into special needs, occupational therapy, parenting, self-care, overall health and wellness, and so much more.
We are here to provide raw, honest, and fun strategies, ideas, and information for parents, therapists, and educators, as well as other professionals to implement into daily life.
Thank you so much for joining us.
Hey there, welcome back to All Things Sensory by Harkla. I'm Rachel.
And I'm Jessica, and today we are talking with Maranda and Jenny about a really unique topic.
Always. This one's actually so unique.
Very unique.
They're so interesting. These gals are local to Boise, so we brought them into our podcast studio. They are here with us, and I'm going to give you a little background on their story, their journey, and why we ended up bringing them on the podcast. So Maranda and Jenny, they are both BCBAs. They provide behavioral training and support for caregivers and families, which consists of family-focused treatments and interventions that equip families with the tools they need to foster behavior change in their natural environment. They provide behavioral consulting services for schools and daycares and other providers by implementing realistic strategies and techniques to increase skill acquisition while still decreasing and managing challenging behaviors. So they own a company called What the Function, which is where they are providing their services, and they are in the juvenile criminal justice system, helping children and their families just be able to thrive and get to a moment of being able to thrive. And their journey is very non-traditional, very eye-opening, very, very eye-opening. So I'm really excited to chat more and to share this story.
Yeah, let's jump in.
Hello, ladies. Welcome to the podcast.
Hi, thanks for having us.
So excited.
Me too.
We start every interview with 5 secret questions.
Okay.
So we're actually going to do those first.
Yep. And we change all of our secret questions.
Oh, no.
So you have
Can't
no
prep.
idea what to expect.
Put on the spot.
You guys can both answer them.
Okay.
Since we have both of you. Okay, first one. What podcasts besides ours are you listening to right now?
I listen to The Toast.
I don't know
It's
that
hilarious.
one.
It's like they do like the fast 5 stories that you need to know before you wake up and take a bite out of your morning toast. And it's like pop culture, but also like things going on in the world. They're hilarious.
Oh.
Yeah, highly recommend them.
Okay.
Yeah, they're really funny.
Okay.
Yeah.
And you?
I follow The Toast, like Facebook, but I like the Skinny Confidential.
Yes.
Yes, love
Yes.
them, love her. And there's this one, Something Was Wrong or something. It's like they follow these criminals' stories and like
I'm not
dissect and
surprised.
investigate. So I do kind of dabble in that a little bit.
Okay.
My Favorite Murder is also a
Yeah, I hop around.
The crime podcast.
Oh, yes. Yeah.
Yeah.
For sure.
Okay.
What is one food you could eat every day for the rest of your life?
Pasta all day, every day.
But not olives.
Not olives. No, not those olives. But like I will have pasta until the day I die, I swear.
Okay.
Pasta, sushi.
Okay.
Yeah.
Okay.
Not Idaho sushi.
Of course not.
When I was in
different.
Seattle.
No.
Yeah.
course not.
That's fair.
Okay, would you rather only drink coffee or only drink tea?
Coffee.
Okay.
Yeah, for sure.
We always get ourselves in trouble when we ask that question because usually when we ask it, people are like, I don't drink coffee, I don't drink tea. And it's like, what do you drink in the morning?
Seriously, how
do
are
you
you awake?
survive?
Yeah. What else are you doing?
Yeah.
I try. I've tried to be a tea person. I'm
Same.
a coffee girl, yeah.
Yeah. I know. I have tea at my house and I haven't touched it in over a year.
No, I know. I'm the same way unless I get like sick or something. Yeah. But like absolutely coffee.
Yeah.
Yep.
Cool. If you could, would you go back in time and try to change things, whether it's your life or the world events?
No. Only because I've like watched a lot of videos about how like this like one little weird decision.
The butterfly effect.
Yes, the butterfly effect.
Yep.
So no, I don't think so.
I don't think I would either. I'm a big person of like, I don't regret anything that's happened. I more regret the things that didn't happen that I should have done. But I won't change anything because that's why we're here today.
Yeah.
You know?
But even when I look at the things I didn't do, it's kind of part of why I'm doing what I'm doing now.
Exactly.
So,
Exactly.
Yeah,
Yeah.
just the process, I guess.
Everything happens for a reason.
Yep.
Totally.
Okay, my favorite question. What are your sensory quirks?
Oh my gosh.
Give them to us. Give them to us. All of them.
Certain sounds, like just like, I don't even know if they're like oddly specific, but just like some, like when a bug flies past my ear, I'm like, I just literally want to like collapse. And then like certain pitches.
Yeah, I'm sensitive to tones of like voice and stuff, I guess. But when I'm like wet, like out of the shower, or when I used to be a swimmer out of the pool, I can't touch paper, like printer paper. I like would carry things like this because I couldn't touch it.
That's a new one.
I also have a lot of like stimmy things.
Yeah.
I feel like if I'm nervous, I'll start like touching my earlobe. I have a lot of sensory things. Oh, sheets.
Sheets for
I'm
sure.
weird about sheets. My husband makes fun of me.
Like, what do you mean weird about
Like
them?
a
They have to be a certain thread count or a
Not
certain
even,
type
because
of material?
Sometimes it's the lower thread counts that I can tolerate. It's some certain feel.
Do you like
them?
the microfiber cloths?
That's my sensory
No.
thing. Like,
Yeah.
I can't even.
No.
It makes my skin crawl. Like,
Yeah.
it makes it crawl.
I've had like sheets where I've had to put like a fleece blanket over it, and we've had to like get like new sheets because I can't touch the sheets.
Okay.
So yeah,
Yeah.
lots of quirks.
Yes.
I know.
You fit in with us.
Okay, good.
I'm the quirky one. Jessica's the integrated one.
I'm pretty
is what we-
integrated.
Is what we say.
What are your
Which
quirks?
ones? I mean, there's so many.
Pick your favorite.
Gosh. The sounds, definitely. Too many competing sounds gives me the heebie-jeebies. A little vestibular sensitivity. Like to fidget. You're a fidgeter.
Yeah.
But like the touching of certain materials, you know?
Yeah.
And like when your skin is dry and it like catches on the material.
Like the micro
Oh, yeah.
fiber
The
cloth.
microfiber
Yeah.
cloths.
Yeah. I never realized my hands are so dry until I touch those cloths, and I'm like, nope.
I know.
I worked with a kiddo who like knew me so well, and if like fingers scratching on jeans,
Like that?
yeah, I do not like that sound. So when he would be pushing buttons, he would start. Yeah, we laugh about it now because he's much older, but
Oh my god. Okay.
Yeah.
lots of little triggers.
Yep. Yeah. No, definitely.
Yeah, especially with kiddos, right?
Yeah.
And when you're immersed in this field, you can't help but be aware of your own sensory things.
Yes.
Totally. You're learning about what triggers your kids, and you're like, oh, I actually don't like that at all, or oh, I crave that.
Yeah.
Yeah.
Well, and especially like she was saying, like with some of the kids who get to know you so well, like my feet, like, I don't know, playing footsie is just never like I can't. And like, you know, some kids like really need and I'm like, I have to stay calm. Like literally, like I want to run away right now, but I can't. But yeah, no, that's definitely another.
The foot,
Yeah.
just feet touching.
Yeah, it's just like I'm just not a footsie.
Even with shoes on.
Yeah, even like I'm just like, leave me alone.
Jessica, watch your feet over there.
I
Don't
know,
cross your
I'm over
legs
here.
to the other one.
I am fine bonking into you guys, but when it's done to me, I'm like, absolutely not.
It's like
Yeah.
an overexposure thing. I feel like
Yeah.
I'm easily touched out because I'm just constantly.
Yeah.
Well, that and you have a toddler, so.
Well, yeah, that's a whole nother.
I feel like it's worse.
That's a whole nother world.
Oh,
Yes,
yeah.
totally.
Oh, yeah.
Okay, well, now everyone knows your deepest, darkest secrets.
Yes, great.
So fill us in, kind of give us a little introduction, what you do, why you do it,
How you
all
got
the
started.
things.
Okay. Yeah.
Well, we are board certified behavioral analysts, BCBAs. We have a company called What the Function. And what we do is we work with families and kiddos and providers and all of these individuals to help with maladaptive extreme behaviors and also increasing skill acquisition. Our main focus right now of what we're doing is we work in the juvenile justice system. We contract with the state and we help kids and the families get the kids to stay home, really increase the parents' tolerance and skills to be able to work with their kids in a productive way, in a safe way. Because what we've learned in this process is it's roughly about 90% of the kids in the juvenile justice system have a disability. And, so we really work with the families on being able to have a safe environment for them.
Yeah. The families are kind of our main client.
So you are working with the families?
Yes.
Okay.
They're our main focus in that natural environment. How can we equip them with the strategies to help increase those skills in their kiddo or decrease those skills in their kiddo or de-escalate appropriately, right? With that, we do a lot of consulting with other providers. So it's very multidisciplinary where we want to train and educate, speaking in the juvenile system, specifically like prosecutors, judges, public defenders, probation officers, and then also those other disciplines like, OT, speech therapists, teachers, and how can we support those environments as well and give them the strategies they need to make these kids successful kind of across environments.
Okay.
Yeah.
And this just seems like such a different area for this profession to be in. So how did you get into this?
It literally fell into our lap. We were not seeking it out. I think Jenny and I have a mutual interest in, it's like forensic behavior analysis is what this is technically called. But we got a call from a case manager, and there was a kiddo who she had heard about our services, and she was like, I think this would be a really great fit. It's a little bit different than the referrals we've gotten in the past. He had pending charges. He was older, all of this stuff going on. And she was like, and I heard about this funding source that could be available to you because he's in the court system currently. And we're like, oh, cool. Like, let's go. Let's talk to the parents. Let's see if we're a good fit. And we were. With that came a denial, an appeal. We're like, no, we like the funding source denied us. We were like, wait, no, like let us talk to you, let us sell ourselves. Yeah. They approved us, and
that
we've been approved ever since.
Yeah, took off really. We've had a lot of success doing what we've been doing, and we really build that rapport with the family. Just giving them the skills because they also have a lot of learned behavior as well as, their kiddo. And so we kind of need to adjust that a little bit, and help them through that. There's a quote that we use a lot, especially when we're talking to judges and prosecutors and all of that. That's like when a flower doesn't bloom, do you blame the flower or do you look at its environment? Like what's making it not bloom? The soil, the sun, the heat, whatever it might be. And that's kind of what the approach that we take, and we're not coming in and being like, you're not doing anything right. You have to fix all of this. We're coming in with very basic skills and strategies to make little adjustments to make it be successful in whatever environment they may be in. A judge once told us, like, we're not born in a vacuum, like we are not born with the ability to know what to do for kids with high needs. You have to learn that. And we've also realized throughout this process, there's been a lot of, gaps in certain services and for these families and for these kids. And so we're trying to bridge that gap and just provide them with the most support that we can with the science that we use. Yeah.
So you're seeing the kiddos and the families after they've already gone to juvenile detention, or it's kind of walk me through what the process
Not necessarily.
Okay.
It's truly so different for every client that we get. where they might be on orders of release. So yes, they've been released from detention, and now we are working with them in their home, in the natural environment, right? Supporting that transition back. The goal is always to try to keep them home. Some kiddos, they're getting referred to us before that release has happened. So we're providing some of our services in the detention setting with kind of the caregivers and the kiddo, and then also with parents or caregivers only in their homes to kind of prep for that hopeful transition home. And with that comes a lot of like advocating during court hearings, things of that nature. And then some kiddos are back and forth, unfortunately, throughout our time with them because they've had such a history of, you know, getting charges pressed, going back, getting released, having no support at home, and then parents don't know what to do, the police get involved. It's kind of a cycle that we're trying to break.
Do you feel like it's pretty successful though when you guys go in and work with these kids and young adults? Right?
It's been really successful.
It has.
And you know, because it's different than, I mean, a lot of these kids are going through the same cycle of, okay, so they commit the crime, they go into detention, they get released, and they're going back to like full days at school, like a gazillion services, and wow, this isn't working, you know? And so we kind of come in with a different perspective and really an objective view on things. Like Miranda was saying, like sometimes these kids are in and out just because, you know, of the order of release. Sometimes it's like if you break a vase, like you have to go back, like, or if you're on permit, all of this stuff. But you know, we found a lot of success kind of just really building the rapport with the parents, letting them know that we're not here to judge. Like, we're literally not. Like, you can tell us anything. And by the way, we've heard it all, seen it all, and worked with it all. And, you know, just providing that validation that what they're going through is difficult. And same with the kid, you know, and being able to work with them from kind of all angles, especially even like detention staff when they're in there, like they can start that process so we can generalize that to the home environment. We do some crisis calls as well to really model the things that we've implemented with the families, you know, and that's been really successful and very different than things that they have already had access to. Which has been, I mean, really, really important for them to break that cycle. We're going to try something different. And, you know, when they come in and out, like we're looking objectively of like, okay, when they got home this time, they stayed home this length, but oh my gosh, look at the behaviors completely decreased in intensity. That's a win. You know, they're not going to come home and be perfect ever. And none of us are, right? And so kind of reminding judges, prosecutors, public defender, whatever, that you guys might not see progress, but this is actual progress. It's not linear, you know, but let's look specifically. And that gives the kid validation that they're not these horrible, terrible kids that can't do anything right. And same with the parents. You're not horrible, terrible parents that can't do anything right. It's, you don't have the skills yet because you have not been taught them.
Well, there's a whole other side to it too, right? Where you have this kiddo with a very complex medical history, multiple diagnoses, developmental diagnoses, mental health things at play. And these kids are getting bigger, right? They're not the 3 or 4 year olds. They're 14, 15, 16. And what ends up happening is the parents are at a loss and they call the police. The police come out and de-escalate, but part of their protocol is typically to arrest or take in. So a part of our work is also really advocating to that side of the system. Like, how can we equip you guys with strategies to know how to work with some of these individuals? But also, how can we teach the parents, did we really need to call the police then, right? Like, let's come up with a criteria. This is what dictates a call to the police. This is what means you need to use de-escalation strategies. And kind of when do those two lines start to blur to make sure we're keeping everyone safe. You know, every family's capacity for what they can handle in their home is very different. So those criterias are never black and white. In the eyes of the law, it's very black and white. So we kind of come in that gray area and we're like, well, this family can handle this family cannot, right? And so this is when you need to call the police for help. And this is when maybe you can handle it at home. And how can we support that?
Okay, I did kind of have a question. If you, let's say for anyone listening, if they have kids in this space or, you know, they've thought about like calling the cops on their kids because they're like, I don't know what else to do. Could you give us a few of your like go-to de-escalation tips that a family could try?
Yeah.
Which is hard because you don't have like a specific
hard,
client, but like what are usually like your go-to strategies?
You know, it's
If there's like aggression, you know, and things like that.
Well, you'll hear us talk a lot about the function, the function, like why are they being aggressive? Are they trying to access something? Are they trying to escape something? Is there a sensory need at play? Is there an attention component at play? So that part is a huge factor in how we would, you know, give suggestions. But
the biggest thing that we say, that we, I guess, tell parents is consistency. So whether the kid is being physically aggressive because he's been denied something, right? Don't just give it to him because he's physically aggressive. We need to come up with a different strategy that still keeps everyone safe, because, you know, that might escalate the kid more and all of that stuff. And, you know, trying to escape certain situations, like running away, like all of this stuff. But the biggest thing we say is consistency with whatever strategies you're using, which is hard.
Yes.
You know, especially when you're like, I am wiped. You know, I've been getting yelled at for 24 hours and it's just getting me, I'm tired. Like sometimes the parents, caregivers, whatever, they want to escape. Oh yeah. And that's their way to escape. And so using, you know, really trauma-informed care with that as well, and talking to the parents about like, you have your trauma from situations and learned behaviors from certain situations. Same with this kid that's now 15, 16, 17, right? But the biggest thing is just consistency, even when it's hard.
We speak to learning history a lot kind of in our field, and the parents and kids have a very long learning history that we're trying to disrupt or break. And it takes a lot longer the older you get, right? The more of a learning history there is. And the parents, it often takes some time for us to get them to realize it's their learning history that we're also trying to change, right? Your patterns, how do you change your responses to the behavior? But also always preventative stuff is going to be the most helpful. We try to teach parents to look for those like precursors, we call them. Like, what are they doing when you know something's coming? And what can we do in that moment to prevent like the big outburst?
Yeah, we say the same thing, like proactive strategies instead of reactive strategies.
Totally.
Exactly.
Especially with like sensory strategies too. You know,
Exactly.
if you can.
And another thing is just, while we are a lot of times within this space trying to reduce those maladaptive behaviors that lead to a call to the police, you know, we're trying to proactively, like you said, increase skill acquisition for like functional communication. Like, are you trying to communicate something, like even just saying like, I'm mad, or like maybe even swearing and saying like, whatever it might be, like, okay, that's communication, you know, like let's try to increase that prior to anything happening, so you can use those skills. And if those don't work, we'll move into you know, the de-escalation strategies and stuff. But you know, putting little things in to their life day to day will increase skills while you know, simultaneously decreasing. So the proactive work is definitely something we address.
And it's very important too that we make clear that the police are a tool, and we want them to be a tool. That's something that you need. The community needs it, right? They are there to help. But so sometimes our like advocating and our services come into play on the other end, where, okay, you did everything you could. You called the police because that was what was going to keep you the most safe in that moment. But then how can we advocate on the other end, where do charges need to be pressed? You know, when you look at the judge's decision and prosecution, or it's like, is punishment the way to go, or do we need to look at intervention and almost like rehabilitation is kind of how they'll refer to it in the system, where we need to teach them skills so this doesn't happen again. Or if you're just throwing them back in detention, it creates this loop and then they're not really learning anything. Which is kind of when Jenny spoke to, there's this missing huge gap of services that are missing, that don't support these kiddos who don't really belong in detention, but there is no place for them to receive this intervention. So we're trying to kind of fill that a little bit with these transitions home and teaching and the families and everything.
You know, and kind of going back to how many of these kids in the juvenile justice system have disabilities.
I was just going to say, like, you said 90% of
huge
these.
overrepresentation, right?
Yeah.
Like, that's not normal.
No. And, you know, so that's where, you know, those gaps in services have been really lacking. And we talk a lot with like the juvenile system of like intent and like disability and like what the difference is. For someone with an intellectual disability, low cognitive IQ, oftentimes they are hypersexual, right? And they commit a sexual crime. There's a difference between being almost like, in a way, like a symptom of the disability, which, by the way, it's still never okay to commit these crimes at all. But how can we, rehabilitate, in a way, these kids to learn how to effectively release that, behavior instead of committing a crime? And that's what we need to look at, where, some kids who, and by the way, they might have a disability, they might not, who commit violent crimes, all of this stuff, are also doing it for a reason. Whether it's like the reinforcement of, stealing, beating someone up is so much more reinforcing than the consequence of going to juvie, getting charges. So we need to figure out what motivates them, and kind of, we have to look at it a different way. And we've really started to learn a lot about this kind of way of doing behavior analysis, and using the science in this capacity, which has been really, really fun.
ADA outlines a lot of this, but it's like, how can we teach you guys to make sure we're following those things, right? Like right to accommodation. Well, that's something that kids have a right to even when they're being arrested, right? And how they're being spoken to or interacted with. And it applies to prosecution, right? When the decisions that are made, the intent thing is big, because are these kiddos really doing this knowing what they're doing?
Knowing the consequences.
Yeah, and that's a really hard determination to make, by the way. So it is, it's really challenging, but it's something that we are wanting them to take into consideration, and the outcomes are so much better when they do overall.
I just can't get over that this is your job.
Yeah, we can't either.
Yeah, I know.
It's nothing we ever expected.
Everything we wanted but never expected.
Yeah.
Even if you Google, like, how do you get into forensic ABA? There is no real straightforward path that just kind of...
Are there any courses that you can take to...
So yes, it's more of like a criminal psychology course. Part of our ethics code is like, if you ever are going to move into, I guess, another phase of behavior analysis, which there are many, and people don't really know that because they associate it with one thing, like the forensic behavior analysis. Think of the behavior analysis unit, BAU, like
FBI.
in that, like they are using the science that we use, just applying it in a different way. But now we're kind of doing the same. They have organization behavioral management, like sports behavior analysis, all of this stuff. But when you move into a different like subcategory, I guess you can say, behavior analysis, it is within our ethics code too. You need to find a BCBA or a psychologist who is already doing that to mentor you and consult with you, so you can gain that experience and competency within that realm.
Did you guys find anyone?
We did. Yeah. It was a challenge.
Yeah, I bet.
She's awesome.
Oh, she's amazing.
Yeah, she's in Georgia.
Yeah.
Oh, cool.
Yes,
But
and she's been fantastic in supporting kind of our practice and how we want to keep evolving and improving and learning and
hopefully expanding. We want more BCBAs not only here in Idaho but doing this kind of stuff, because the general consensus from everyone that's talked to us is like, there's nothing, like we didn't have these opportunities. Like I wish you would have come like 4 years ago. And we're like, same.
And we wear a lot of hats. I mean, it's just Jenny and I right now. And we do other things at What the Function, right? But this is it's ignited such a passion in us that we didn't, I don't even think was there to begin with. And we both kind of are aligned in that, and it's been really exciting.
Especially because with what we were doing before, which we still love to do, but like this, almost like the stakes are so much higher with this, and like you just kind of dive on into it, like we don't have time for the honeymoon phase. Like you got to tell us everything. You got to be raw and vulnerable, and
we need like the nitty gritty, like get down and dirty with the details, and we really have to gain that trust really fast, because there's been times where it's like we don't have time, right? We get started and then the kid's released, and then you might be wanting to call the police tomorrow. And we have to try to prevent that, because the system doesn't wait. Kind of like what, we've advocated a lot in court, like, okay, they were home for 4 days, and you see that as a huge failure, right? But last time they were home for 2 days, right? And then the next time they made it like a week. And that's progress when you look at a graph or the data points, but they don't always understand that, because it's just about keeping them out. Yeah. And, you know, they get reprimanded for making the same choices again, but they don't understand. So how can we help them? Yeah.
And, you know, being kind of able to expand the box that everyone was thinking in has been really exciting for us, and different, and something that we've just like grown such a passion for. But
people have been so receptive to it in that world, which we were not anticipating.
I mean, how could you not be though? Like, you guys are really on the side of the kids.
Yeah.
Like, you guys are really advocating for these kids. You're not like, well, these kids are naughty, let's stick them in jail. You know, like, that's not your MO at all.
No. And the people that work in this, we want everything to work together for these families and kids, right? And that's really our main goal.
And to kind of open up everyone's eyes, like you said, like, he's not just a naughty kid. There's this amazing podcast by this amazing BCBA, and the title is literally like, there's no such thing as a bad boy, you know? And it's like, we come out of the womb with not, you know, experiencing that. Obviously there's like different, you know, stuff that contributes differently, and we might, but why are we just sitting here and being like, the kid is the issue? He is unsavable. Like, sorry, just throw him away. And it's like, to be able to open up the eyes of like, hey, maybe we could try something a little different that hasn't been done, and also give grace to people. No one wants to be judged by the worst thing they've ever done. And kind of that helps remind the parents who have been in these like fight or flight moments with these kids and have a lot of this trauma stemming from them, of like, we have to change just little things that are attainable that you could do every day. Kind of like when, you know, you want to lose a ton of weight, like, I'm not gonna never eat again, work out 24/7. Like, it is just little stuff that's gonna make you successful.
Okay, I have a question. Are you guys court ordered to work with these families, or do the families find you and to work with you?
Sometimes both. Well, typically the families are recommended by somebody to us, but we have been court ordered where we have to submit, you know, data and progress and letters of completion or not a successful completion, and that's kind of a part of their orders of release or part of probation sometimes.
Most of the time, how our specific funding within the contract that we use with the state works is that the probation officers usually are the ones that reach out to us, and whether that's a part of the order of release that they need to be working with us before they even get sentenced, put on probation, or even after. Sometimes judges will be like, you got to go see them. Like, you've got to work with them, and we have to get that letter of completion. Like, that is a part of the process. You know, and just with that funding in particular, that's how that works. But like, outside of that, with the other things that we do, families can find us. But with the court stuff, it's usually...
The court stuff's all backwards from what we typically do. Someone is like, work with what the function, and then the probation officer requests, and then there's no real rhyme or reason. They just give us this authorization. So we don't recommend, hey, we think they need X, Y, and Z. We take what they give us, and we go from there. And then you can get more, right? Typically we've never had an issue with that, but we kind of, whereas at the other side of our business with the other clients outside of the juvenile system, it's more typical. You get a referral, assessment, we make a recommendation.
Okay, so you do see clients in kind of like that traditional ABA way outside of the juvenile?
We're not doing
system?
Like direct, what you would think of as traditional.
Okay.
What people probably have in their minds as direct ABA therapy. The families are still our main focus on the outside. The family, intensive family training, caregiver support. So still wanting to do the same things, but maybe it's in the home and with younger kiddos. We do some IEP advocacy. We do some consulting with other providers.
We have, gone in with, game changers and really like worked with that in a consultant, like kind of standpoint of like, hey, like you're seeing a lot of behaviors here. Like, why don't we try like less of this, like less touching, hands off, like more just like verbal like kind of that stuff, just like little tweaks. And same with, going into providers' offices, whether it's like a medical provider, even dentists. Sometimes you guys probably know, like dentist is hard for a lot of kids. So. It's hard for me. But we provide just basic support and tools, like people can reach out to us. And so that's how we consult with like daycares, schools, even,
like little staff trainings and stuff. I mean, we've done something like potty training, because a kiddo, the parents really needed them to go to preschool, potty trained. We've done potty training support.
Okay.
Just some advocacy. Yeah, it's kind of all over the board, really. Yeah.
Well, let's address the elephant in the room.
Yes.
So many people
Yes.
have conflicting thoughts and feelings on ABA.
Yeah.
So let's talk about that.
Yeah, there's so many things. We could probably do an entire separate interview on this, right? ABA has a reputation of being an autism therapy, essentially, right? That comes from the fact that that's typically the only way that it's funded. So you can't get your insurance to cover it typically without a diagnosis. Not always. There's those, random cases. And it's kind of like every profession is what we tell people. There are bad BCBAs. There's bad teachers.
There's bad OTs.
Yeah, there's bad OTs. There's bad doctors. And anyone who's had a negative experience with ABA, it's totally valid. You know? ABA is applied behavior analysis is a science, right? It's a behavioral science. BCBAs are supposed to use those principles therapeutically. So you can do terrible things with ABA, right? The science just exists. And it's up to the provider to be ethical and have good values and, meet the needs of the families, what they believe in culturally, all of that stuff. And it just doesn't always happen. But
And, kind of to expand on what Miranda was saying of behavior analysis is a science. The science has not changed because science doesn't change, but the applications of it, which is what makes it applied behavior analysis, has changed given, not just in our field, but in everyone's field, the trauma-informed care. We only use evidence-based practices. We're really using the compassionate today's ABA. We are not the BCBAs that are like, you only need 40 hours a week, no school, we're sitting at a table the whole time, I want to change everything about you. No, it's like we want to, really help you blossom in what makes you you, understand that you have trauma from whatever it may be, the parents as well. We are all for the more like naturalistic setting for those clients who are able to do that. While it's important to mention, there are some really, really severe clients that, do need to be in a more controlled setting in order to be able to generalize to other settings prior, with those extreme behaviors, self-interest behavior, all of that stuff. So we're never going to take away from people's experiences how they feel, but we also want to let people know, like, we're not trying to make anyone normal, because guess what, that is not a real thing. Like,
it is normal.
What is
literally.
normal?
And normal's boring, honestly. Like no. And just really help, really give access to more environments, more experiences. Just if we can't do that, then we're not doing our job. We want to work ourselves out of a job, so you don't need us anymore. Like, all of that stuff.
We don't believe in designing services around like billable minimums, right? You hear a lot about that in the clinic setting. I'm sure you guys are familiar with. We've never seen kind of a plan that we necessarily agree with when it comes from that. Like, oh, you have this kiddo and he has to have 20 hours a week because that's what we need to meet this requirement, which is all driven by money, right? That is not how we practice behavior analysis.
And we treat the behavior, not the diagnosis, which is why we also want to let everyone know that behavior analysis is for everyone, everything, all the time. We all use it. We all use it. And so it's not just for a specific population, which is what it's been, widely like marketed as. Kind of like we were mentioning before, like all the different avenues that you could go in it. They're not having like disabilities or coming into a clinic setting for however many hours. It's we all use it every day, whether you know it or not. And a lot of what we do is an overlap,
Exactly.
And
I mean, if you write yourself a checklist, you're essentially using a principle of ABA
True,
to keep yourself on track, right? And we've had clients that don't have a diagnosis at all, which is something that we're really trying to kind of spread awareness of. Like, this doesn't have to be for somebody with autism or any disability at all. That's just a big part of what we want to do, is educate not only the community but families, other providers on everything that behavior analysis can do. And that's not to say when you do have a kiddo who qualifies for every therapy under the sun, ABA may not be what is determined to be the most important. So that's when we come in from like, okay, you don't need ABA therapy. That's OT is your number one. Okay, so can we support your OTs in addressing maybe any behaviors that are there that could impede on your session or impede on your progress? Like, it's very multidisciplinary in that sense, where we just want to be a part of a team.
And that's the way that should be. That's how it's most successful. It's not just one environment, this is what you do in this environment.
Exactly.
These are the things that you have to follow, the principles. It's like, no, these kids are going all over the place and doing so many activities, and they have to respond to all these different adults who are talking to them in different ways and using different approaches. And if you can tweak little ways that other adults are talking to these kids, maybe you'll have more success or
exactly
things like that.
And relatively speaking, I mean, the world of ABA is a new practice, right? We were also both previously special education teachers, which comes from a very dark place, historically before things evolved. And it's the same in every profession, and we're evolving, we're learning, and not all professionals do that, and a lot of them do. But I think the negative experiences obviously kind of get the spotlight. So
they do.
Yeah.
And I mean, that's to say for really anything as well. But since we can only, I guess you can say, control what we can put out about the positive experiences and impacts, like, by educating these like parents, caregivers, even the kids, if they go to seek ABA therapy, then they can understand like, oh, that's a red flag. I don't really want to do that, because those providers are not really moving towards what is supposed to be happening right now in this day and age. And so by opening people's minds, educating, people can make informed decisions. And that's also something that we're really just trying to get across as well.
Could you give us any red flags if like someone listening is like, hey, I want to go do ABA? Like, what are some things that they should look out for when we're like, they find a great practitioner, and then maybe
there's a lot of things. I mean, the main thing would be if there is some type of minimum that, especially if you've got a 2, 3, 4-year-old, a little kid, and they're saying that you have to meet this minimum of hours per week. I can't think of many therapies where a 3-year-old needs to attend 20 hours a week of.
And like have like going towards like nap time, like, taking, like, it's just, we've had clients come and tell us like, oh, before I even met these people, it was my first phone call, and they said they couldn't take us further if we didn't agree to at least a 20-hour. And it's like, you don't know this kid. Like, some of these kids like can't do more than a 2-hour session a couple times a week without it just completely derailing their progress everywhere. So like, do you even know the kid's date of birth?
It's like a quality over quantity thing. There is such a thing as a kiddo being oversatiated in something to where it's no longer doing
we feel that too.
What it's supposed to do, right? Sometimes less is more in a lot of ways. We are big advocates of an appropriate model for like family and parent training, where there's a time and a place for clinical. Sometimes that's the best fit for a family. It's not necessarily our style, so if there's ever someone looking for clinical, we would refer them elsewhere. But the family and parent training is so important, because how else are they going to like generalize? How are the families going to understand what's going on? I mean, not to say it's easy, but compared to other things, it's easy to gain control over a lot of these behaviors in this like beautiful
controlled
setting, right? And then they go home and the parent's like,
what do I do?
Nothing's working, So that piece is so important, and I think that it's neglected, or at least not done as well as it could be in ABA.
Another one is the provider or providers, whatever, not, telling you what the kid needs to work on. Basically doing that without understanding, like, culturally and socially, we all have different expectations for our kids. Like, a good one that we use is like, I don't care if my kid swears, like, that is fine. But then others are like, we need to nip that in the butt. I very much care. That's against, and so we can't come here and give a blanket answer for everyone. It has to be individualized. So if they're not taking your culture, like your social, like all of that life into consideration, even if you do tell them and they still are like, nope, your kid needs to, one of the things, make eye contact. I don't really care. Like, no, like that is not, I barely make eye contact, what I mean? And I am doing just okay. And, so just making sure they take what you is important to you and this kid, and how to make it successful within this kid's life, you know, because that's ultimately what we're trying to do. So that's also a big red flag, that they're not culturally and socially aware.
Yep, I love that.
If they want to work on stimming, especially at a young age, that's a big that's a big red. I mean, there's a time and a place depending on the skill level where if the kiddo especially can say, like, if the client can come to you and say, this makes me feel different or weird, I don't want to do this so much. Okay, maybe, right? We can talk about alternatives or a system to put in place. But if they're wanting to reduce stimming that isn't harming the child,
because there are different ways to stim that, you know, does harm the child.
Yes.
And so that's also important to note that
like a lot of the SIB stuff is, you know, self-injurious behavior. It's sensory, right?
Exactly.
And we do need to work on that, because we can't have you
burning yourself,
poking your eye out, right?
Yeah. So that's just another thing, which is another way to, you know, kind of talk to the family about, like, what is important for you, what is your capability, kind of tying it all together, understanding that aspect of it, which know,
ties into that family training, because if you even set one foot in some of these families' homes, so many things will click. I mean, I taught in Seattle for 5 years, and I would do home visits, and I was like, oh my goodness, this is why these kids do this, is because this is what they do at home. You know, I remember working with OTs, and I was like, we can't write a utensil goal for this kid because they eat with their hands at home, and that's not important, right? The same thing applies to our setting, and learning what's going on in the home and what's important to the family, I think, is the most important when designing any type of intervention in any discipline, really. But
and what the family is capable of carrying over to, you know, we can create a beautiful sensory diet for a child, but if the family can't do it because they're overwhelmed or experiencing that trauma, then it's not going to actually be helpful.
Exactly.
We see that a lot back into the juvenile system, right? It was like, this is going to be the best thing you could ever do. But if you can't handle it or do it with consistency, well, let's do this. And you're still making progress, your quality of life is improving, but we're not overwhelming you with all of these strategies and interventions. And
you know, another red flag is just when providers of any, you know, field can't come in with an objective standpoint. You know, a lot of what we all as a society do is have a lot of learned history and come in subjectively and judge a lot of people, whether it's people we see out in public and, you know, oh, that kid is naughty, he's screaming, they can't get control. It's like, well, maybe he has something going on that you just don't know. You know, and just any provider that sits there and cannot be objective, that is judging the capabilities of a family or the child or the parents, that's a huge red flag, no matter what provider type they are.
Yeah, absolutely.
Yeah.
I mean, we could go on about red flags. Also, just trust your gut. You know, as the family, as the guardian, as the caregiver, as parent, you really do know your kids best. And if you don't feel like someone is, you know, in line with that as a provider, trust it. That's what we always say. Trust your mom gut. We say
exactly.
too. You know?
And like these providers work for you. You know, so as a parent, you're like, even your pediatrician works for you, you know? You can go find another one. You can find someone else. We get that a lot with OT. It's like, people ask us, like, hey, I don't really get a good vibe from my OT. It's like, you're not stuck there, you know? You have to try. Everyone's not everyone's cup of tea, so you have to try and find someone who fits right and actually takes the time to build rapport with the kids. And I feel like that lacks a lot nowadays, is that, you know, it's all about money, it's all about numbers and yada yada. It's like, we need providers to like build rapport with these kids, like get to know them. Ask them questions. Like, what do they like to do? Do you know what their favorite color is? Do you know what they like to do for fun?
So go back to the basics. And we all learn in all of our professions, like, build a relationship. You know, they have to like you and respect you and trust you is a huge one.
And that's just, you know, probably one of the biggest red flags of someone not willing to do that with both the client and the families. You know, especially these kiddos who are non-verbal, non-vocal, whatever. You are their voice for the time that you're with them, and the parents are the voice for the other time, right? And to be able to be open and honest they're going to receive information better, and also you are as well. And that's just, you got to. And honestly, you learn that's the best way not to get burnt out too. You like find a connection somehow, and
actually enjoy it.
Yeah, actually enjoy it 100%.
I mean, being able to be, big enough of a person and to say, I don't click with this kid. I'm not the right fit. For whatever reason it's a really hard thing, I think, for a lot of providers to do.
It's a good skill to have as a therapist.
Yeah, very important skill to have.
Well, and then even to continue off of that, to admit when you have done all that you can for this kid and maybe it's time for them to see someone else. Yes.
We've run into that a lot. Yeah. We've had, you get clients who 3-4 years and it's like, I love them. I've done so much, but it's time for some fresh eyes, fresh perspective,
And that's okay to admit, and I think also as a parent, it's probably hard to admit that you need help anyhow. So making sure that you can reassure the parent, like, I'm not coming in and telling you that you are doing all of this stuff wrong. I'm trying to help you. And it's okay to admit that I literally have no idea what to do. But that's a really hard thing for anyone to admit that they need help.
Yes, it is. Well, I will tell you, I've never actually thought about therapy in the criminal justice system before until I met you guys. Yeah. So I'm really glad that you guys came to the podcast.
Us too.
Yeah.
It's been great.
We're happy to be here.
Yeah.
Just a few wrapping up questions. What would you say is the biggest challenge with day in, day out, your jobs, your careers? What do you feel like is the biggest challenge?
Man.
I think the lack, well, not even the lack. I think we're coming from so far behind just because of where the majority of things are at just in the juvenile criminal justice space. That's probably one of the biggest hurdles of it's really easy for us to build the rapport with the kids and the families to get that buy-in, but to get everyone else to buy in has been, and educate themselves and expand what their view is on this kid has been probably one of the most challenging things that we face. And also emotionally, we have really big hearts, and sometimes we've had to learn, like, my heart either is too big for this moment, or like I have learned how to separate it. Otherwise it just wouldn't continue.
I mean, dealing with the lack of resources and just how to navigate that and still do the best that we can do for these families. There's our job, and then there's the educating the community piece of it, right? Which isn't necessarily a part of our job, but it's really important.
You guys are passionate about it.
In order to grow, in order to get people to understand, the impact that it can make. And I think that's more challenging than some of the behaviors and things we're dealing with, right?
Almost just like the system that's in place.
The system, yes.
You guys are working against the system.
Well, the system is not designed to work with us or our families, so trying to make small steps.
And it's also not designed to support these kids in the way that they need to be supported, or the families. And I think, just like you said, the system is the hardest part because there's so many parts of it. And while we're just a small part, like, if not everyone's playing together and doing that, it's just, and that's a hard thing for us to deal with as well.
And also managing, burnout and being able to put boundaries in place. Like, we want to do it all and say yes to everything. And we just can't, we can't for a lot of reasons, and that's hard for us too, because you want to, you want to answer every call and every text and fix every problem for these families.
So
and
I know.
We want to take everyone on, but like, there's only so many hours in the day, and there's only 2 of us, so hopefully our field within the criminal justice system will grow. BCBAs will grow and help these kids within this part of the field.
Hopefully what the function will grow. We do supervise incoming BCBAs and would love to, like, spark some interest in this area.
I know. I was going to say, you guys need to make like a course or something for other BCBAs.
And we would love to take, like, on an intern to kind of see if that works, like, get someone really more immersed in this part of it, and just opening and expanding everyone's idea, and not just, like, about our field, but the population that we're working with. It's important for people to understand them more and not just place judgment on them or the families.
Because they're some of the most incredible people we've ever worked with. It's been really, really fun. A lot of learning. We've probably learned more than they have, to be honest.
No, but it's been a wild ride, and we love it and hope to continue and hope to make progress with our kiddos and in the system.
Well, I just love like you guys can just, you resonate passion in this field, and you can just tell. And like, if anyone listening is like, BCBAs, you know, it's terrible field. It's like, there's not a bad bone in your guys' body. You know, it's like you are literally doing this with the child, the family, the system's best interest in mind. You're like, what more can we do?
Right.
And you just don't see that very often.
No. Well, we really appreciate that you can see that, because
you
it's really
can,
true.
And we just appreciate you guys having us on here to kind of talk about that
the
and
awareness.
Well, and geek out a little bit on it.
We're talk all day about it.
Seriously. Seriously.
Well, on that note, how can people find you, learn more, reach out to you?
We have a website, whatthefunction.net. Email, you can submit inquiry through there. We're on Instagram. I think we're on Facebook.
We'll link everything
in the message us.
show notes.
Yeah. Cool.
That's the best way.
Cool. Yeah.
Okay. Hit us with your questions. What do you have for us?
So our probably like biggest question, and also one of the challenges within being inside detention, Miranda had alluded to the lack of resources. You know, a lot of these kids, especially the ones with the disabilities, are overstimulated in there. There's a lot of noise, a lot of metal when people clash because they're angry. The resources available to them, even like the clothes that they're allowed to wear, as you know, like people are very sensitive to these kind of things. The resources lack so much that like the quote unquote headphones that they can get for that aren't like real headphones. Like they're just like static and they're kind of flimsy.
Like old tape players.
That don't actually work.
That
And so our question to you would be like, what advice, especially for the older kids, would you give us to help them with their sensory like stuff and
in that specific environment?
They require like not a lot of stuff, right? So we don't know all the rules and regulations about what they can bring in, but
Well, I guess it depends on like, can you bring tools in for them to use?
And
not us.
No, we can.
Yeah.
So you just need like strategies that they can do like with their own
they might
body.
be able to provide. I know they provide poppets, and there might be something that they can provide. We're not exactly sure. But
Half of the poppets are broken.
Yeah.
You know, the headphones
don't even have working markers half the time.
It's a very underfunded
so you need like heavy work strategies, like
for just what happens when the kid can't wear the clothes because maybe it just feels weird, like, okay, like you're in an isolation room because of something and you have the metal bed and someone next to you is like banging so hard and your headphones aren't working, but you're so overstimulated because loud noises suck, right? And that's everywhere in there. So like, what tools can we give them that doesn't necessarily require a physical object? Can we use with them?
I feel like you're going to say crawling.
Probably, I honestly would say crawling. If you, I mean, can I give you my book? Can I like, can you guys like implement the crawling program?
Because they do have like activity times to do activity, and the staff is receptive. Like, hey, have them do some of these exercises. You know, we don't know.
I feel like honestly, any type of body weight exercise, you know, you think of like the traditional working out exercises, squats, push-ups, but really those are forms of heavy work that are going to stimulate the proprioceptive system, which can potentially help regulate the nervous system. So, you know, that could be like something to try.
Hands together,
the wall,
pulling them apart, pushing down on their head,
Okay.
pushing their tongue to the roof of their mouth. Like it would be interesting to see if they're actually receptive to these ideas, but if you can, you know, explain it to them, like, all right, your body is in fight or flight right now. Let's try some sensory, and maybe even just explain to them if they can understand, like, these are heavy work strategies. They're going to calm you down.
Let's
do them
tool
together. You know, let's jump up and down 5 times, and then let's hold a Superman. Let's try to move the wall. Do you think we can push this wall? And while it's not going to take away the sound, it's not going to take away the sensory overload from their clothes
or the environment.
Generally, those heavy work strategies are what we recommend for anyone who is oversensitive. When in doubt, probe it out. That's kind of like the
and that's great to do, especially if they have to spend the time in their cell or the isolation cell because they're being watched, or you know. So those are great strategies, honestly.
We would love your book, because like we get put on time with, I don't know what else can we think of to tell them to do besides
you got to buy this, and like you're not funded for that. You know, you can't even get like a pencil in there.
Well, I was gonna say, I imagine that you're probably restricted on what things they can have in there with them.
We have asked, you know, can they have like real headphones? Like at least like the
really
ones
good
that really
noise
block out
canceling.
some noise.
Or just ones that work,
Yeah.
period.
Yeah.
You know, even because they get it for like the radio thing, but it's just static because, you know, it's cement and metal in there. So it's not all.
This is like about, you're not allowed to buy. I'm like, can you, I mean, I'm sure we can get people to donate. You know, anything to have some more stuff for these kids.
Yeah.
If anyone wants to donate anything, please do that. These kids need it and deserve it.
Yes.
Very much so.
Like weighted vest, could they wear a weighted vest in there?
Probably.
I think so.
Yeah, because they do have some garments,
Yeah,
depending on
like shoes and stuff, you know, and a weighted vest isn't necessarily any more dangerous than, and there is levels.
I mean, they could
of,
take the bags out and throw them. That would be like the.
But you could sew it in.
yeah,
you could, yeah.
So nice.
Yeah,
And
but-
even if they were allowed to throw a bag at the door or whatever, or
Yeah,
the
A
wall
metal
would be
symbol,
cool.
like
yeah.
you know what I mean? Because they do have school time, which is great. They do have like
Are they in here all the time?
Yeah.
they're in
This is when they're in the detention
yeah in
center.
detention. So
Okay.
like for people who don't know, like detention is like
Basically
jail,
jail.
you know, and prison is like after you get sentenced and all that stuff. So where we go in the Ada County Juvenile Detention Center, shout out all the staff there. You know who you are and we love you. They are the ones that are like with them all day, every day.
And not necessarily, you know, sectioned out into like security levels, but there are like certain rooms if they have, you know, concerns about self-harm or anything like that, they might have to be in a room with a camera with even less stuff available to them. There's things like that. So I guess that would be a factor, but if they're in a room, there's their regular rooms. I think they have a little bit more flexibility.
Like, cards? Could you have like activity cards or picture cards that you could
In certain
rooms,
rooms, you
Yeah.
can. Like the like clinical supervisors, like they have like kind of like I guess you can say group and therapy rooms. So they have a library in there, which is beautiful, right? But the books, like I don't know if they can always come out. Like if they earn it, they can. We have seen cards in there because we played. We do bring like our
Well,
own
I'm thinking
stuff.
like sensory diet cards, you know, like visual cards
Because they do
that
run
could
like
have.
PE-S classes.
okay.
So it could be a cool thing like, hey, can you tell them to like maybe incorporate, because they're doing like volleyball or basketball and maybe they can incorporate, you know, some other little exercises.
Yeah, absolutely.
Because a lot of these kids really do learn to advocate for themselves. It just, what are they allowed to ask for, you know, and what works for them. And
And depending on the kid where they're at, they might have different access levels. Because there's a tier system in there.
and how like intermingled are they allowed to be, like boys and girls. It's like all very dependent on what's going on with that specific kid. But
I think for me, it's always just like full body heavy work activities is my go-to.
okay, good to know.
Yeah, really good to know.
I'll give you my book, and then I'll give you like my sensory diet cards too that you can like
We'd love to.
try. I mean, you can print them out. You can, you know, do whatever and like give them to the staff and different activities and ideas.
Give them to the families.
Give them to the families.
That'd be great,
Yeah.
especially.
I'll donate that.
That would be amazing. Yeah, but no, all of
goodness.
this is such good and useful information. Just like little things like that, where I don't need like a whole like sensory gym. You know what I mean? Like, what can I do with what I have?
Yeah.
That's perfect.
Yeah.
Perfect.
Any other questions?
No, I think that was our biggest
That was
one.
our big one.
That was an easy question.
Well, good. I'm glad.
We were in a session with a
though.
kid and we were like, we need to ask them right before we were coming on, like, what can we do? Because it was so obvious, the overstimulation. Like, what else can we do? You know, we don't have any more ideas. So.
Yeah. And with their access, with their age too, it's
Yes.
Yeah.
And sometimes they're more like, I don't want to do that. You know.
Yeah.
So when they're older,
Yeah.
it's harder to get the buy-in.
Yeah.
And, yeah.
When in doubt, probe it out. Just
I like
remember that. And
Yeah.
like teach them that like that is the strategy that everyone uses, you know. I use it, we use it, you use it, you know. We all use this strategy to organize our nervous system.
Yeah.
love that.
Gosh, can we get primitive reflex integration in there too?
I mean,
Just like bring everyone in for like, let's replace these other sessions and
Literally.
do.
well,
Yeah.
I mean,
I mean, you know that all of them are going to have retained primitive reflexes, which is going to keep them in that fight or flight state, and they're
Yeah.
going to struggle even more.
I mean, we'll give you some contact information of some people that would make that happen.
it happen.
Yeah.
That's
Okay.
amazing.
Yeah, because we think that's an amazing idea.
Yeah.
Yeah.
It would be awesome.
Oh my gosh, you guys, this was wonderful.
Yeah, it was so
we could talk all day.
I know.
No,
It went by
I
so
love it.
fast.
I know, it really did.
Yeah. So thank you again.
Yeah, of
Awesome.
course.
Thank you guys so much.
Yeah,
we really appreciate it.
Thank you so much for listening to All Things Sensory by Harkla.
If you want more information on anything mentioned in the show, head over to harkla.co/podcast to get the show notes.
If you have any follow-up questions, the best place to ask those is in the comments on the show notes or message us on our Instagram account, which is at harkla_family or at All Things Sensory Podcast. If you just search Harkla, you'll find us there.
Like we mentioned before, our podcast listeners get 10% off their first order at Harkla. Whether it's for one of our digital courses or one of our sensory swings, the discount code SENSORY will get you 10% off. That's SENSORY.
Head to harkla.co/sensory to use that discount code right now.
We are so excited to work together to help create confident kids all over the world. While we make every effort to share correct information, we're still learning.
We will double check all of our facts, but realize that medicine is a constantly changing science and art.
One doctor or therapist may have a different way of doing things from another.
We are simply presenting our views and opinions on how to address common sensory challenges, health-related difficulties, and what we have found to be beneficial that will be as evidence-based as possible.
By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical condition in either yourself or your child.
Consult your child's pediatrician or therapist for any medical issues that he or she may be having.
This entire disclaimer also applies to any guests or contributors to the podcast.
Thanks so much for listening.